The way that we behave when we're anxious is the main culprit. Hey, do you want to have less intense anxiety experiences? Do you want your anxiety to not rule and dominate your life? Well, you need to behave differently. As harsh as that is to say, the way that we behave when we're anxious is the main culprit. It's the main thing that maintains our anxiety issues. Now, when you are anxious, there are adaptive behaviors and there are maladaptive behaviors. Let's start with maladaptive behaviors because that's typically what most people do, and it's what maintains their issues, their anxiety issue. Maladaptive behaviors are anything that you do in the moment to try and help with your anxiety. Maladaptive behaviors are very easy to do. They don't take much effort for us to do, and they are protective in nature. They are trying to protect ourselves from an experience. Avoidance, chronic avoidance is a maladaptive behavior. Avoiding certain experiences, safety behaviors, protecting ourselves from certain situations if we can't avoid them. So how we shield ourselves from the moment if we can't avoid the moment. Active worry, purposely worrying about things. Active rumination, purposely thinking about past situations. Reassurance seeking in a chronic way, constantly needing to know that you or things are going to be okay. These are all examples of maladaptive behaviors. Maladaptive simply means that these behaviors do not allow you to be able to adapt to your anxiety symptoms and to be able to become more flexible to them. So, what are adaptive behaviors? Those are essentially the opposites of all the behaviors I just listed. When you are anxious, when you're experiencing a trigger or having anxiety, you need to be extremely mindful about protecting yourself from that moment. Try to lean into the moment a little bit, right? Whatever it is that your body is urging you to do when you're anxious, you really should try not to do that. Obviously, we're excluding life-threatening situations where your fear response is telling you to run from a dog chasing you. We're not talking about that. We are talking about anxiety situations where there is no danger present, but you are just experiencing physical discomfort or mental discomfort or both. In those moments, you really want to work on your flexibility to the moment. Whatever it is that your body wants you to do, you should try and not do that for as long as you possibly can. If you want to avoid, try to delay avoiding as long as you can. If you want to protect yourself in a situation you can't avoid, try not to protect yourself as long as you can. Some examples are, wearing sunglasses if you don't like eye contact, or drinking water to make yourself feel less anxious in a social situation, or excusing yourself to go to the bathroom during an event that you can't leave, but you need a social break. All those things just simply eat away at your ability to tolerate that anxiety in those situations. The more you lean into your anxiety and you hang in there, you start to develop a higher tolerance for those situations and those moments. You'll start to notice that those moments become less anxiety provoking to you over time. The first few times you try and hang in there, I'm not going to sugarcoat it. It's going to be horrible. It will be awful. But if you stay the course and hang in there with a determination to continue to try and be able to tolerate that trigger, much sooner than later, you're going to be able to tolerate that trigger much better. What you'll notice is that that trigger just is not as distressing as it used to be. And that's where a lot of people are missing out on just the wonders of having their triggers not be as distressing anymore, because they're actually leaning into their triggers. If you are focused on chasing symptoms and responding to your anxiety in a way that's not allowing you to adapt, you are going to most likely be a slave to your symptoms. You will have no resiliency or tolerance to those symptoms. So, in summary, you want to lean into your symptoms. That is an adaptive response, meaning over time, you are going to start to adapt to the trigger and the trigger is no longer going to be as triggering, which means that you are having less intense anxiety experiences, and that is an increase in quality of life. As always, thank you for stopping by and take care.